Yeah, so as far as sort of the definition of sudden cardiac death or sudden cardiac arrest, we sort of, and it may be sort of defined differently, but generally we say it's the sort of abrupt cessation of cardiac activity, usually causes patients to become unresponsive, and if not corrected quickly, can result in death. And unfortunately, it has happened, right, in sort of the public spotlight. We've seen sort of athletes, right, like the football player that got hit. And oftentimes we can't always pinpoint what the cause is. So any patient or any athlete that sort of survives a sudden cardiac arrest, we usually have to do further testing to figure out what the cause is. Now, I think in the case of that football player, Damar Hamlin, it was actually what we call commotio cordis, where sort of a vigorous thump to the chest can cause patients to actually go into a dangerous heart rhythm and go into sudden cardiac arrest. So there are other causes, some of which are genetic, and those oftentimes you have to screen individuals for. As far as what happened with that football player, that's just sort of a freak thing, and theoretically that could happen to anybody without any sort of significant cardiac history or cardiac pathology. But in patients that are predisposed to having some of these potentially dangerous events occur, generally those are patients that have genetic disorders, and if it's just, unless a patient has symptoms that would prompt them to get a cardiac workup and then make a diagnosis, unfortunately sometimes the first time we diagnose them is after they've had